Thank you, and welcome everybody to this webinar. This webinar really provides an introduction to a series of the 3 following webinars, which look at some particular strategies for causal inference or causal attribution. And I want to start with the basic messages that I want to put across, and that I'd be very interested in discussing with you when we have a chance to, discuss through comments at the end, because it's not just. I'm just checking everyone can hear me. Just if someone could just come back and say yes, I'll carry on. Too good. Yes, thank you very much. Excellent, thank you for that. So as we're going through, if you have questions, please pop them in the chat window, but also if you have comments and you might want to, agree or disagree or embellish this a bit more or tweak some of the messages. So I'll be really interested in your take on these. There's a couple of the key messages that I see. One is that causal attribution is an essential part of impact evaluation, that if you don't tackle it, if your evaluators don't tackle it, you're actually not doing a proper impact evaluation. You have to have some way of handling this, even if it's very difficult. That we need to recognise there are different types of causal relationships, and so how we go about that attribution should reflect how we understand the causal relationships actually work. And then there are a range of strategies for causal attribution, and this perhaps is the most controversial. There's certainly a number of organisations who only talk about counterfactual approaches to causal attribution, and in fact require that for something to be considered an impact evaluation or a rigorous impact evaluation. But I want to put forward the view that in fact there are a range of strategies, and that where a counterfactual is not appropriate, we have other options, particularly looking at regularities and looking at ruling out alternatives. And given the nature of a lot of UNICEF's work, I suggest that these last 2 are ones that need to be taken very seriously, and that's why we've allowed a lot of time to discuss those. So let's start with it being essential. I'm just going to change this view. I'm sorry, I've got the strange view here that's it's really tiny for me. Right, okay. The issue here is that we often collect data. People talk a lot about measuring. You might measure something about the activities, the UNICEF activities, and then something about the results, the changes that have occurred in health and well-being, particularly for children. And what we say in an impact evaluation is you have to have something connecting them. You've got to have some arrows. And those arrows is usually a chain of intermediate results. And sometimes that chain is pretty straightforward. We can understand it. It's linear and it's not too long. So some types of service delivery are very clearly and tightly linked to this. So setting up drinking water services, obviously, if they work, you lead to better intake of clean water, and associated health benefits that we understand pretty well. It's also the case when you have something with a slightly longer chain. So providing maternal birthing units, birthing kits, there's a longer chain to get to healthy mothers and children. But again, we can sort of identify that and see how that goes. But the point that's important for UNICEF is that this also applies for the sort of upstream policy work. So it's a much longer chain, going from working, in an office, working with policymakers, working to build capacity within partner governments to develop their policies and to implement them well, to then having better outcomes for children in terms of reintegrating child soldiers back into schools, for example. There's a much longer chain there. There's a lot of other players involved, a lot of other factors that affect it, whether it's successful or not. But even so, even in these more complicated causal chains, we have to make some fist at causal attribution. And whether you call it causal attribution, causal contribution, causal inference, causal analysis, it depends a bit on the sort of discipline you come from and the type of relationship you think is in place. So some of the errors to avoid is actually just missing this entirely. And I have seen this in a number of impact evaluations, including UNICEF impact evaluations, so-called impact evaluations. And there's one in particular that acknowledged that it really hadn't investigated causal attribution at all systematically. It just really had measured, we did this and this happened. But then they claimed the program had been effective because they said they were trying to increase service usage and the service usage had increased. Well, that's just not a valid conclusion to draw. If you can't put up some compelling argument that there's an arrow in between, you really can't conclude that it's effective. And most of our evaluations are trying to, in the end, say, did it work? For whom did it work? Was it effective? What were the broader impacts? And so this sort of looks fairly basic to say it's an essential part, but when you look at some of the evaluations that have been done, it's been left out. And I think it's sometimes because people think, well, if I can't construct a counterfactual, there's nothing I can do. And that's why I think it's so important to realise you've got a range of strategies, and that when you're engaging evaluators, that you put them on the spot. You say you have to deal with this issue, and know that you have a number of options for it. So thinking about the different types of causal relationships, we often talk about programs and their impacts as if it's a very simple system where they're both necessary and sufficient. And it's a bit like hitting billiard balls or snooker balls, where one thing hits another which hits something else, and you get a result out the end. And in reality, very few of our programs are like this, that the program by itself is the silver bullet that will make all of these things occur. It's much more likely that we have a causal package. We have our program together with other programs, or our program together with a favourable context will produce the outcomes. And this is really important when we're trying to think about how we investigate causal attribution, because we should be recognising what that causal package is and investigate if that's there. And we'll look at an example shortly where maternal literacy, for example, was seen to be part of the package that was needed to make this work. And so when you're collecting data about it, you need to collect data about the context and see whether that theory holds up. And then the other one is where it's sufficient, but it's not necessary. There are other ways of achieving that outcome. And this particularly applies in capacity building programs, where there might be a number of agencies working to strengthen organisations in different ways. And so if you have those involved in your program and people not involved in your program and not getting any input from another agency. So I think thinking this through is really helpful, thinking through what else is needed to achieve the results, what do we think is needed, and what are some alternative paths to get there. So it's really thinking much more about your theory of change. And we had a previous webinar that talked about theories of change, and in that we looked at this example from Zambia, looking at the child grant. And what you'll notice here is that they've identified the other factors which can either help or hinder achievement of the impacts. And one of them particularly they're picking up here is maternal literacy, that this was actually a necessary part of the package to achieve the outcomes. And what this means then is if you can check that out when you do your evaluation, if you collect that data and you're able to disaggregate and check that pattern holds. And it really helps you when you're trying to use those findings to either replicate or scale up or translate this program to somewhere else. If it really only works in a context of good maternal literacy, you'd be selective about where you would roll it out. Or you might see, is there a way to adapt it so that it will work in a context where there isn't good maternal literacy? Maybe we need to look at different communication processes that will work for people with low literacy. So it's really helpful in terms of the scaling up. All right, so now let's think about the strategies for causal attribution, because there really are a number of organisations that really limit it to counterfactuals. And this sort of quote from the USAID, for example, has as part of the definition of impact evaluation that it has a rigorously constructed counterfactual. And by that they mean an estimate of what would have happened in the absence of the program. So it's very often that you find some individuals or a site that wasn't involved in the program, and you compare that to those who were. And there's a number of ways of doing that. But I'm really influenced by a lot of the more recent thinking on this, which is really going back a lot to research methods and saying, you know, there is a bigger repertoire there. I mean, evaluations sort of got stuck on the counterfactual approach, but there are other ways of assessing cause and effect that can be rigorous and can be scientific and can be systematic. Astronomers don't have counterfactuals because they can't do experiments with control groups. They have to use these other strategies. So a number of these were outlined in this. The first one there was a guide to impact evaluation I did with Interaction in 2012. The one in the middle is a really interesting research project that Elliot Stern led for DFID in 2013, which was about broadening the range of methods for impact evaluation that really went back to the roots of the philosophy of science to say what are the different strategies there. And very recently this new one has just come out this week, which is a shorter version of that report that's geared up for program managers. So it has a lot less technical information, but still making the point that there are different strategies for it. And Nicola's going to provide you with the link so that you can download that. That's freely available. Right, let's just get this working. Okay. So let's look at these different strategies. So the first one is this notion of a counterfactual, where we compare what happened when people were involved in the program and compare that to those people who weren't involved. Now, if what you do is you just compare volunteers with people who don't volunteer, you end up with quite different groups. You know, you say, well, you might be picking the most motivated people who volunteered and got involved in something. And so then the fact that they succeeded might not be because of being involved in the program, but because they were much more motivated instead. And that relates to a whole lot of other factors which has produced the results. So one of the ways of doing this is the experimental design, where you randomly assign people to the treatment group or the control group. And the random assignment's really important. That decreases the chance that you'll get groups that are very different. It doesn't totally take it away. And we can call this a control group. And the point here is that you can randomise individuals or households, or you can randomise sites or regions, so to either be in the treatment or the control group. And this one, in the coming weeks, you'll get a particular webinar just on randomised control trials that will take you through a lot more of the how to do it, how to oversee it, how to ensure you're getting good quality in that. But if you can't randomly assign the individuals or the regions or the sites, you can use quasi-experimental designs where you have a comparison group. So they're not randomly assigned, but they're constructed in another way. And there's a number of ways of doing this. One of them is to try to do a judgmental mapping, where people look at it and say, look, I think they're pretty similar. Or you actually have matched comparisons, where you actually collect the data on a number of important variables and you match them very carefully on those. Or you might use sequential allocation, where instead of randomly assigning them, you assign, you know, every second or third one to one of the groups. The other two on the other side are a bit more complicated. The regression discontinuity it's suitable for a program where you have a cut-off range, where if at a certain point children are accepted into a feeding program, for example, or at a particular income level, people are accepted into a cash grant. What you can do here is you compare people just either side of that cut-off point and say, look, they're going to be very similar because it's not a big step, and then you can compare those across that level, and you can compare those who then participated and those who just missed out. And the propensity score matching is suitable when you have a program where people volunteer to be involved. So it might be that they're watching a media program, that's a communication for development information program, or they're choosing to participate in some training, or they're a government department choosing to get involved in a capacity building program. And what this does is it doesn't match them on their observables, it actually constructs a score of their propensity to be involved, and then it matches them on those. And all these quasi-experimental methods will be the focus of a later webinar, so I'm not going to go into those in a lot of detail. But they still have this basic logic. It's trying to construct a group that you can say, here's a group that's like the people who had the program, or they're like the sites that had the program, except they didn't have them. And they're not exactly the same, but they're close enough that when we compare them, we're pretty confident we can see the difference the program makes. Now, this example comes from Uganda, where they did a cluster randomised control design. They looked at 98 villages that had early childhood development centres, and they randomly assigned one of 3 intervention arms, so that they either provided food, they provided a cash grant, or there was a control group, which currently at that stage wasn't providing anything. And this was a UNICEF evaluation. What's interesting here is that they found that the food transfers actually made very little effect on the outcome measures, whereas the cash transfers had broad impacts across a range of the outcome measures that they were looking at. So the first bit of finding was, you might say, well, the cash transfers worked and the food transfers didn't, but they did much more than that. It was a good evaluation in that they didn't just stop there. And it's really important that they didn't, because if you just stopped there, people might generalise that and say, oh, food transfers don't work, but cash transfers do. But what they did was that they also looked at the quality of implementation, and they found a number of problems. One is that the actions they were giving out were very limited, and they often weren't seen as very palatable. They were nutritious, but they weren't particularly palatable. That they thought some of their food measures, the measures that they were using to collect data, weren't very good because they were looking a lot at variety rather than the nutritional content. And they had a fundamental problem with implementation, where for a number of them, they didn't get any of the food rations for a number of them, the months. So the fact that it didn't have an impact is not surprising. And you would look at this and say, I think we've had implementation failure. And the first thing you'd want to do here is fix the implementation failure, and then see, well, when you do it well, do food transfers have an impact? So here's an example of a counterfactual strategy. It's pretty clear to understand and very intelligent data collection and analysis. We're having a problem with so will I try turning off my video then, and I'll see if that helps. Okay, hopefully that will perhaps reduce the bandwidth a bit, because I hope you can follow along now. Okay. Now, if you are using counterfactual strategy, what you have to do is look for the quality of the counterfactual. You can't assume that just because someone says we're using a counterfactual, it's been well done. And this is something that's really surprised me when I've looked at a number of impact evaluations, that when you look really hard, there's major flaws with their counterfactual, and in fact it might be really quite biased. So there was an example where they said they had control sites. They weren't actually control sites, because they weren't randomly assigned. They were actually comparison sites. But they paid no attention to how different these might have been to the treatment sites. And that's a real risk, because it might be that it's easier to roll out a pilot in the sites that are closer to the main city. And so it's the sort of thing that can often happen, is that the control sites, the ones, or the comparison sites, the ones that don't get the program, are the rural sites or the very remote sites, the ones that are hard to get to. And we know that they're systematically different to the ones that are, closer in. And so any differences you're finding in the changes in health and well-being might just reflect rural poverty and the extreme poverty that you often get in rural areas, rather than the difference the program was making. And it's been quite surprising for me to see a number of them that just say, oh, we had a comparison group, and they really don't investigate it, how comparable they are. So that's something to really look for in that. I want to move on to the other two types of strategies because they're probably less familiar. And the regularity strategies is to say, if we've got a really good theory of change, not just a simple input, this input output, but one that really unpacks what are the steps in between, where do we think this would work well, what's the package that's needed, then you should be collecting data that reflects that theory of change and doing analysis that reflects that. So one of the things you should look at is the achievement of the intermediate outcomes. So not just we ran the program and we got the changes at the end, but can we tick off all the things in between? Was there evidence of those in between? And if they're not there, it's much harder to run the case that it was because of your program. You might look at the results against the expert predictions, and that can be particularly helpful if you can't collect a lot of data about predictors, but you have perhaps program people who've got very good practice wisdom and can start to identify those that they would expect to turn out well, and then you can actually follow that up. You can look at the timing of the impacts. Clearly, if you're looking at something that's going to take a while to show benefits, if the benefits occur really soon, it's hard to run the argument that it was because of your program. So if you're looking at, say, a feeding program, you would expect to see a change in nutrition very quickly, particularly those immediate benefits. But if you're looking at capacity building with a government department, which then leads to them to develop policy, which then leads them to implement the policy, which then leads to resource reinvestment, which then leads to better services, which then leads to improved child health, that's going to take time. And so the timing of when you'd start to see those changes can lend strength to the argument that it's because of your program. You can do some comparative case studies, again looking at the package, the constellation of factors that are producing the results. And we'll have a particular webinar by Del Goodrick on comparative case studies. And if you're interested in that, there's a terrific brief on that really lays out what you should expect there. And it's another area where I think UNICEF could get so much better value out of its evaluations, doing better comparative case studies. We can look at dose response patterns. So in the sites where something's been done well, you would expect to see stronger results. And we can talk to key informants. We can check consistency with existing literature. We can look for a modus operandi, a particular way that you would think things would happen if it was because of your program. And this is something look for in capacity development, where if there's a framework that's been used in the training and then you start to see that framework in the policy, that it's like a signature. You start to say, I can see the echo of the professional development in the policy because they've framed it that particular way. And you can use methods like process tracing that, again, at each step in the chain starts to say, is this consistent with the sort of changes that you would expect to see, or is there something there that doesn't make sense? The other strategy that's often used in conjunction with regularities is to rule out an alternative explanation. So first you have to identify what could be a possible alternative explanation, and you can find that through some previous research, talking to key informants, through some observation, and sometimes through analogy. You can say, well, in another program that was a bit similar, these results were achieved through this means. I wonder if that's the same in this case. And once you've identified those other reasons, you can check those out by collecting some additional data, by disaggregating the data when you do the analysis, by doing statistical modelling to control for various factors, and also investigating possible technical explanations, like, for example, looking at selection bias. So this is all very doable, but a lot of evaluators don't know this, and so you need to be able to point them to good examples. You need to be able to insist that they do this. And I just want to take you through two examples. One that's a very simple one, but I think one that's very helpful to hold in your mind, and then one that doesn't go through in a lot of detail, but points to a more complicated example. So This example comes from some presentation done recently by Michael Patton, who's written a lot of books on evaluation and particularly qualitative methods. And he was talking about the top 10 developments in qualitative evaluation, and he used this example to talk about causal inference in qualitative evaluations. So he's talking about an example in Vietnam where they brought in a new law requiring helmets for people riding motorcycles. And some of the data is saying, well, they did bring in the law, and there was a reduction in head injuries. Very good evidence about that reduction in head injuries. It was very very dramatic, and the timing was consistent in that it happened after the introduction of the law. So how can we use these strategies for causal attribution? Because this was a national law, it was brought in across the whole country, so you really couldn't find a counterfactual. There's not a part of this, there's not people or sites where this wasn't done, so that's not really going to be an option. So one of the things is to actually look at the intermediate steps. So one of the steps is we've brought in the law. Did people actually change their behaviour? And so these are before and after photographs. The before photos, before the law came in, you showed people generally didn't wear helmets. In the lead up to the new law, they had photographs showing shops filled with helmets all of a sudden, that people were buying the helmets and getting ready. And then after the law came in, the photographs of the people riding motorbikes showed that many of them were actually wearing the helmets. Now, this doesn't prove the causal chain, but very strong support. I mean, if on the other hand you'd observe that people weren't wearing the helmets, it would be very hard to run the argument that the law had reduced the head injury. So the other way of addressing this is to say, what's an alternative explanation as to why there'd been a reduction in head injuries? There is a possible one here. What if what people did was that they weren't able to get the helmets, they didn't want to break the law, they feared the consequences of breaking the law, and so they actually stopped riding their motorbikes, that they actually used other forms of transport, or it actually caused great hardship because people could no longer travel. How could you look at that? Well, one way would be to count the use of motorbikes, have data on that you could rule that out as a possibility. If you didn't have that data, what might be something else that could be useful for that? So let's imagine that you have you had data not just on head injuries, but on other injuries associated with motorbikes. And let's say you could track that after the introduction of the law. Now, if you found that the head injuries went down, but the other motorcycle injuries didn't, that would be indicative that leg injuries, arm injuries are just falling off, that continued, but it's actually the head injuries where they were protected by the helmet that went down. So this is starting to point to the sort of injuries you'd expect to be reduced. So it's like a signature, it's a bit like a modus operandi. Wearing a bicycle helmet doesn't stop people having accidents, but what it does do is it reduces the risk of them having serious head injuries when they have an accident. So this, if you found this sort of a pattern, that would lend support to it. So that's I think a simple explanation, and it is a real explanation, a real strategy that was used in a slightly different evaluation in Australia, where they were looking at the introduction of helmets for bicyclists, and there had been a reduction in head injuries around bicyclists, and a real concern that it was because people were no longer using bicycles, that there'd been a big reduction. And by using this strategy, by looking at total injuries, they were able to rule out that as an explanation. Now, that's a very micro sort of impact evaluation, but this overall approach has been used in the evaluation of the Paris Declaration, which was a massive evaluation. It was global. It was looking at a number of countries. The Paris Declaration obviously had all sorts of different ways that it was being implemented and having influence within different countries. And so what they did was that they actually set out requirements around being systematic in how that was how that was evaluated, and requiring the teams to be very clear about how it was expected that the Paris Declaration had made a difference and what evidence they had to connect what was done and the changes that they observed, and that the evaluators were actually required to report on the quality of evidence that was being brought to bear. So that's a really interesting example in terms of different ways of bringing evidence to bear in an impact evaluation, where it was clearly not possible to do a counterfactual because, again, it was a global declaration. And if you were comparing, say, countries that were very active in implementing it and countries that weren't, we know that that would not be a credible counterfactual because they'd be very different countries. So if you're going to be using these approaches of regularities and ruling out the alternative explanations, the error to avoid is either not collecting the data that you need, or when you do collect it, not paying attention to it. And this is something I saw in a UNICEF evaluation where it was a capacity building program, and they argued that it had produced certain impacts and had been really effective. But they had some data in there that just didn't make that a plausible claim. First of all, the programming officer had not gone out, had not visited the people, and hadn't run any training with them at this organisation. And meanwhile, another organisation had worked with them and had done the training. So the fact that they were employed and the fact that there were changes in this organisation at the beginning and end, you couldn't draw the line in between because the evidence in the middle was just not consistent with it. And so all of this was laid out in the evaluation, but they didn't use it. They just reported it, and then they drew the conclusion it was effective. Right? It was a really poor evaluation because it didn't use that information that they had. So I think there's ways that you can really improve the quality of what you do or require from evaluators in terms of looking for these regularities and looking for information that doesn't fit. And is there a way you can explain that away, or do you have to start to say, this just doesn't seem plausible? And the comparative case studies is a particular way that you can do that. So there's some more information that you can get from the briefs. There's a brief that actually lays out these different strategies and a short animated video on that. Then there are particular briefs on experimental designs, the randomised control trials, and we'll have a webinar on that. And looking also at, there's another one on quasi designs and one on comparative case studies, and we'll have webinars on those as well. And yes, we have the animated videos on them as well, which people are often also finding it as a useful explanation that they can use and also use with their partners. The other source of a lot more information is on the Better Evaluation site, which is betterevaluation.org, which is a platform for really sharing information about evaluation methods, and it provides a lot about these methods. It gives strategies for understanding causes, as information about each of these strategies and examples that you can use. So it will take you down to discussions about how to use them well, and I'd be really interested in any feedback you have on that site, because this is an area I think internationally where we need to lift our game. And there's also a 2-page overview of these methods and designs that you can save, print, share, and each of these have hot links to more information about them. There's really is some good information out there, and there are increasingly good examples to share. But I'm going to stop at this point and give you a chance to ask some questions, provide some comments, really reflect on these sort of key messages about it being causal attribution, whether you call it causal inference, causal analysis, causal contribution. Dealing with understanding the causes is an essential part of impact evaluation. That there are different types of causal relationships, and it's important to be clear about how you understand them, which is having a good theory of change. And then out of this come a range of strategies for causal attribution. That counterfactual approaches, an estimate of what would have happened in the absence of the program, can be really important, but they're not always possible or possible to do well, or at all. And so we need these other strategies, looking for regularities and ruling out alternatives. So I'm going to turn over to you, back to Nicola now, who will invite you to